Welcome to Healthy Living. I'm Lori Johnson. Thanks for joining us. Our topic today is public health mistakes. What causes them and what can be done to prevent them moving forward? My guest is Dr. Marty Makary, who is a Johns Hopkins School of Medicine professor and author of the book Blind Spots: When Medicine Gets It Wrong and What It Means for Our Health. Dr. Makary, great to see you. Thank you so much for joining us today.
Great to be with you, Lori. Thanks for having me.
So your book is really fascinating, and when we talk about public health mistakes, we're talking about things that really most doctors seem to believe and then push on the public, push on their patients to, in many cases, with devastating consequences. And you give a lot of examples, and one that really jumped out to me, which is still sort of something we're suffering from, are these peanut allergies. America has more peanut allergies than any other country in the world, and this is something that didn't need to happen. Can you elaborate?
Well, that's right. First of all, the most important part about being a doctor is humility, and it's not putting something out there with such absolutism when the reality is you really don't know. And that's the case of the medical dogma that lingered for 15 years that all children 0 through 3 years of age should avoid peanuts entirely, peanut butter, peanut products. And that recommendation was flawed. It turns out that peanut avoidance in the first few years of life doesn't prevent peanut allergies, it causes them. And so the hubris of the medical establishment in issuing this broad recommendation, which was only reversed about 7 years ago, ignited the modern day peanut allergy epidemic, which is real and affects a lot of kids. And that's why peanuts are banned in a lot of schools. And we have expensive therapies to address this problem. This problem doesn't exist in Africa and many parts of the world that did not adopt this arrogant recommendation by the American Academy of Pediatrics.
Can you talk a little bit more about this attitude? You talk about how when someone challenges one of your beliefs, you tend to double down on it.
Well, in medical science, you have to be impeccably honest and objective. And it turns out medical dogma, when it sort of gets put out there, can take on a life of its own. The opioid epidemic was caused by the medical establishment putting out a dogma that opioids were not addictive. The obesity and diabetes epidemic may have in part been caused by the dogma of the food pyramid that was financed by the food industry. And the peanut allergy epidemic falls along those similar lines. The psychology of groupthink is that we tend to believe what we hear first, not because it's more logical than new information, but simply because we heard it first. And that sort of intellectual laziness means that our brains will subconsciously reject new information or reframe it to fit what we already believe. And that's just not a scientific approach. And we do it in politics, in business, in relationships, and in medical science as well. And so if we truly are going to be objective and open-minded, we need to recognize that our brains have that human tendency and then temporarily and actively suspend our biases as we consider new information objectively. That's what we need to be doing in medical science, and probably a broader lesson for society in general.
There are so many examples. You know, fat is bad, and that was something that we saw in the 90s. Don't eat fat. And so everybody loaded up on carbohydrates, and then the obesity epidemic skyrocketed. Talk about antibiotics, how public health got it wrong with antibiotics, and that led to where we are now.
We have to look at scientific questions differently. We've got to welcome big ideas into medical sciences. Maybe we need to treat more diabetes with cooking classes than just giving people insulin. Maybe we need to treat more high blood pressure by talking about sleep quality and stress management. Maybe we need to talk about school lunch programs, not just putting every 6-year-old on Ozempic, as the American Academy of Pediatrics is recommending to treat childhood obesity. We've got to study environmental exposures that cause cancer, not just the chemotherapy to treat it. We've got to talk about food as medicine and the microbiome and the overuse of antibiotics. Antibiotics save lives, but they are also massively overused, and they do damage to the microbiome, that is your gut, because the gut is normally lined with millions of different bacteria. And those bacteria live in a natural equilibrium that are involved in digestion. They train the immune system. They even produce serotonin, which is involved in brain health and mood. And so this microbiome is central to health. It's been in a blind spot of modern medicine. We don't talk about it much. But the newest research on the microbiome is that when kids take antibiotics they don't need early in life, they're altering their microbiome. And because that microbiome is now different, we see higher rates of obesity, learning disabilities, asthma, celiac disease, many of these chronic diseases. And there was a dose dependent relationship in the study. That is, the more courses of antibiotics a young child took, the higher the risk of all of those conditions. And it's not that surprising. Farmers have noticed for many years that when you give animals antibiotics routinely, the animal is fatter. And that's why antibiotics have been inappropriately used to increase production of food from animals. And just like the antibiotics make animals fatter, new research shows that it increases childhood obesity. So when the doctor says, hey, the antibiotic may not help, but it won't hurt you, that is medical dogma that new research is shedding light on that every parent needs to know about.
And could you also talk about hormone replacement therapy as well? It's sort of a similar situation.
There's probably no medical intervention that has improved the population health outcomes for women more than hormone replacement therapy at menopause, arguably with the exception of antibiotics. Women feel better and live longer. They live on average roughly 3.5 years longer. Their rate of long-term heart problems goes way down when they start hormone therapy within 10 years of menopause. The rate of heart attacks is cut in half. The cognitive decline after menopause and brain fog goes down by 50 to 60%. If a woman falls, her bones are stronger and she's far less likely to need an operation for a bone fracture. The overwhelming long-term health benefits are clear in the medical literature, and it relieves the short-term symptoms of menopause, the hot flashes, weight gain, mood swings, brain fog. So hormone therapy is amazing, but there was a medical dogma propagated 22 years ago by the National Institutes of Health, where a doctor claimed it caused breast cancer when the data never supported it. The data never found a higher rate of dying of breast cancer in the giant randomized trial of women who took hormone therapy versus those who did not. And that was a real tragedy. And sadly, that dogma lingers long today, not just in the public, but in the medical establishment. 80% of doctors refuse to prescribe hormone therapy because of that breast cancer fear. And 50 million women have been denied this incredible therapy that improves health outcomes and alleviates symptoms because of that medical dogma. People need to know the truth about it, which is why I write about it in the book.
And we definitely appreciate the knowledge and the information. It is critical information for us all to understand. So the book is called Blind Spots: When Medicine Gets It Wrong and What It Means for Our Health. We're going to take a break and be right back with Dr. Marty Makary.
Stay connected with CBN News all day across our platforms.
Welcome back to Healthy Living. We are discussing blind spots, when medicine gets it wrong and what it means for our health. We're speaking with Dr. Marty Makary, who wrote the book. And Dr. Makary, right before the break, you were talking about this medical dogma, these widespread beliefs among the medical community that are often wrong and are harming patients. Can you talk about this testosterone therapy for men?
Well, testosterone therapy for men, once their bodies stop producing high testosterone, turns out has many health benefits. And there's been a dogma that testosterone replacement for men with low T causes prostate cancer, but that's been disproven now. Just like the dogma that hormone therapy for women after menopause causes breast cancer, we now know that's no longer to be true. And so it's not a panacea, but at least that discussion should take place. And the dogma that it absolutely should not be considered is part of how we get in trouble in the medical establishment. We need to be open to new scientific evidence. And the evidence on testosterone replacement therapy is that for men, some men feel better. They are more likely to stay in shape. They lose weight. It can improve sexual activity. And there are other health benefits that we're starting to uncover. Now, it's not easy to take, and you don't want to take it at any pill mill that sells it. There's a sort of dark industry that sells this stuff. But in consultation with a physician, there can be a lot of health benefits to testosterone replacement therapy in select men who have low testosterone and may benefit from it.
And then there's the idea that all women, getting back to the ladies now, age 40 and above, should have a mammogram once a year. What about that?
Well, it turns out we've never had a randomized controlled trial of mammograms showing an improvement in overall survival. Now, we believe once a woman who's low risk of breast cancer turns 50, that there's probably a benefit there. And that's why we recommend mammography for all women once they turn 50. But recently, the medical establishment, with no good scientific evidence, dialed down that recommendation for women to start it at age 40, even when they're very low risk. That is a recommendation that many of us are not convinced is a recommendation we should be putting out there, and certainly not with the absolutism by which it's put out there. We don't know if it saves lives. We do know that it can create tremendous anxiety when there's a false positive. Sometimes it can lead to unnecessary operations. And there's radiation that we're giving in the mammogram. So if we're doing that frequently, is there a risk of all that radiation when we start it at a younger age? When we don't know something in medicine, we need to have the humility to say, this is an opinion. We don't know.
But so many people, when the medical establishment makes a mistake, they distrust everything that comes out of any doctor's mouth. What about that?
We are dealing with an epidemic of mistrust, and the medical establishment has taken notice. They are very concerned about the distrust, and it's been a topic in the medical literature. There's been a lack of humility, and there's been recommendations put out for the general health of the public that are not based on science. They were based on a gut feeling that ultimately ended up being wrong, and you did not see the correction or the reconciling. And this theme of paternalism in medicine, it's not just during COVID. COVID was a sneak peek, a snapshot into how a broader medical establishment works. During the HIV epidemic, they would not allow patients to test for HIV and get the results on their own. They had to come in and a doctor had to explain the results. During a time when home pregnancy tests were developed, the medical establishment fought these tests from being available to women with the paternalism that women can't handle this information on their own. We have to be in the loop and follow them. And so we've seen a theme of medical paternalism. And in my opinion, that's what drives the distrust, not the civil discourse among medical experts to explain their opinion with the rationale that they have directly to the American public.
Such a great point. All right, we're going to take another break and be right back with Dr. Marty Makary. The book is called Blind Spots: When Medicine Gets It Wrong and What It Means for Our Health. Stay with us. Welcome back. We're talking with Dr. Marty Makary, author of Blind Spots: When Medicine Gets It Wrong and What It Means for Our Health. So, Dr. Makary, obviously a lot of your criticism is pointed at the medical establishment, doctors in particular. Patients are wondering what they can do to protect themselves and their loved ones regarding their own health. And so we see so many Americans suffering from chronic diseases. What advice can you give to regular people?
Well, first of all, we don't want to create hysteria in the general public about the medical profession. If you're in an emergent or urgent situation, do whatever the doctor tells you. But when it comes to chronic abdominal pain, or what's actually causing our epidemic of autism or autoimmune diseases, or the general inflammatory conditions that are now epidemic in society, we don't have a good answer for you. I happen to be a cancer surgeon. I focus on pancreatic cancer at Johns Hopkins. Turns out the rate of pancreatic cancer has doubled in the last 20 years. Is anyone in my field talking about it? No. Is anyone working on that problem to try to figure out why? No. And it turns out when we look at this explosion of chronic diseases today, the fact that half of children are suffering from overweight or obese medical conditions, that 20 to 30% of kids have fatty deposition in their liver now, a medical condition called steatohepatosis. The fact that 20% of kids have prediabetes. In other countries like Japan, it's 1, 2, or 3% of kids. We have got to take a step back and look at the role of toxins in the environment, our food supply, the microplastics that the body tends to reject and initiates an immune response to sort of battle these exposures along the lining of the gut, and that causes inflammation that may drive some of these diseases, even the rise of cancer in young people, something that the medical establishment is observing but has no explanation for. If you look at what's in our food supply, we have additives and products in the food supply that are not in the food supply in Europe or Canada. They've been banned there, but the food companies make two versions of cereal, one for the United States and one for overseas, where those substances are not allowed. You look at the role of seed oils. Seed oils, that is sunflower, canola, vegetable oil, the cheap seed oils that are really byproducts of the petroleum industry, where they recognize there may be a role for these substances in cooking. But it turns out that in the modern era, the byproducts of these seed oils are not naturally occurring. The body is probably trying to reject them and engaging in an inflammatory response. And for the average child in America, 20% of their calories are from ingredients that do not appear in nature. They are derivatives of seed oils. So there's an effort now nationally to say, hey, maybe we shouldn't be cooking with seed oils. We shouldn't be buying food with tons of ingredients, including being laced with seed oils. And we should do more research on this, because if you don't look with medical research, you may not appreciate the damage that it may be doing to the population.
That is such great advice. We're going to take one final break and be right back with Dr. Marty Makary. The book is called Blind Spots. Stay tuned.
Your news channel, your shows, the stories you care about. Anytime you want, anywhere you want. Download the CBN News app today.
Continuing our discussion now with Dr. Marty Makary. The book is called Blind Spots. Dr. Makary, you know, the United States, we're not a healthy nation, unfortunately. Do you think we just need to take a new approach to health?
I do, Laurie. We have the sickest generation of children in the history of the world. We have the most over-medicated population in the history of the world. And in some cases, we're engaging in the medicalization of ordinary life. It turns out that medical research is actually teaching us that many biblical principles are where the truth lies in medical science. It's almost as if new research is now reminding us of the role of meditation and prayer, being still, of being calm, addressing stress, the importance of healthy foods, including whole foods and clean meats, and the importance of relationships and communities. We even are now discovering the benefits of fasting.
And you won't necessarily hear that from your primary care physician, who is probably more likely to prescribe a medication rather than tell you to make lifestyle changes. So this is something that in many cases we as patients need to do on our own. Am I correct?
That's right. People need to ask questions. They need a physician who listens and will partner with them, because we do know that a small group of people at the top of the medical establishment have made a lot of mistakes. They don't have a very good track record. But the rank and file doctor in America is a good person trying to do what's best, oftentimes thinking independently and trying to figure out how to tailor the big recommendations to an individual.
We're entering into the cold and flu season, and so many doctors recommend a flu shot every fall. What are your thoughts on that?
Well, we've been doing this every year for a long time, and it's not working very well. The flu shot is effective, but the effect size is small and it's variable depending on the season. We need a universal flu shot. It's been in development. I don't think pharma is too excited about it because it would get rid of the annual routine of getting everyone the flu shot. And the reality is the flu affects people differently. Those who are high risk may have a greater need for a flu shot compared to a young, healthy person.
And what about these mosquito-borne illnesses that we're seeing on the East Coast right now, actually in 30 states right now, EEE, Eastern Equine Encephalitis, and also West Nile? We see some jurisdictions shutting down parks, heavily spraying with pest. What is your recommendation for average people who might be afraid of these mosquito-borne illnesses that a lot of doctors say are only going to get worse because of climate change?
Well, we are seeing some more tick-borne and mosquito-borne illnesses, but remember, it's way down from what it was. There was a time when large swaths of the population of Boston and Washington, D.C., which were essentially built on swampland, would die from mosquito bites, from yellow fever and malaria. It's always been good and safe practices to reduce tick and mosquito-borne infections.
Dr. McCary, any final words for our viewers?
We've got to start addressing the food supply in the United States and environmental exposures, the ultra processed foods, the added sugar, the refined flour. These are not ingredients that appear in nature, and they are causing chronic diseases at epidemic proportion. The sickest child in the world is an American child. We have epidemic rates of obesity. The age of puberty is going down each year. Fertility is going down each year. We've got to start addressing these issues and not play whack-a-mole on the back end of chronic diseases, which is really what our American medical system is built to do.
All right, Dr. McCary, thank you so much. The book, once again, is called Blind Spots: When Medicine Gets It Wrong and What It Means for Our Health. We appreciate your expertise and your time today, sir.
Thanks so much, Lori.
And thanks to you for joining us for this edition of Healthy Living. I'm Lori Johnson, and we'll see you again next week.